Hey, it's MedTerm Basics with Ms. Sherman. Today we're going to talk about suffixes. What categories do they fall into? What kind of information do they provide? And how they complete our medical terms. Suffixes fall into three categories: diagnostic, procedural, and adjective. Let's take a look at diagnostic first. Diagnostic suffixes give a name to what's causing a patient's signs or symptoms. What's wrong with them? Algia means pain. Myalgia, pain in a muscle. Emia, blood condition. Septicemia, blood condition of infection. Ea, condition. Pneumonia, condition of the lungs. Itis, inflammation. Laryngitis, inflammation of the larynx. Okay, let's look at some more diagnostic suffixes. Megaly means enlargement. Cardiomegaly is enlargement of the heart. Oma means tumor or mass. Myeloma, tumor of the bone marrow. Osis, condition, usually abnormal condition. Nephrosis, abnormal condition of the kidney. Pathy means disease or disease condition. Encephalopathy is disease of the brain. Okay, let's go through our last set of diagnostic suffixes. First we have rhea. Rhea means flow or discharge. Menorrhea, flow of menses, period. Raj, excessive flow or discharge. Hemorrhage, excessive flow of blood. Raja, excessive discharge also. Menorrhagia, excessive discharge of menses. It's a really heavy period. Sclerosis means hardening. Arteriosclerosis, hardening of the arteries. Urea is urine condition. Hematuria, urine condition of blood in the urine. All right, next we're going to talk about procedural suffixes. Procedural suffixes name things that we're doing to our patient. Things like tests, treatments, surgeries. Okay, for our procedural suffixes, we start with centesis, surgical puncture to remove fluid. Arthrocentesis, surgical puncture to remove fluid from a joint. Ectomy is a removal, surgical removal, resection, excision. Tonsillectomy, surgical removal of the tonsils. Gram is record. A mammogram is a record or x-ray of the breast. Graphy is process of recording. Angiography, imaging or recording of a blood vessel. Okay, for our next set of procedural suffixes, we have lysis, separation, breakdown, destruction. Hemolysis is destruction or rupture of blood cells. Plasty, surgical repair or surgical correction. Rhinoplasty, surgical repair of the nose. Scopy is process of visual examination. Bronchoscopy is visual examination of the bronchi. Stomy is an opening, a new opening. It can be permanent or semi-permanent. It's an opening that's going to stay for a while. Tracheostomy is a new opening in the trachea. Okay, here we are on our last set of procedural suffixes. So we have therapy. Therapy means treatment. Cryotherapy, treatment using cold or by freezing. And tomy. Tomy means incision, to cut into. Phlebotomy, incision into a vein. Yay, we made it to our adjective suffixes. Adjective suffixes turn the word into an adjective, a describing word, which means we've only got half the story. We have to have other terms so we know what it is that we're describing. So you'll always find an adjective term with another term. Adjective terms mostly mean pertaining to. So they just tell us what we're talking about. All is pertaining to. Renal, pertaining to the kidneys. All is like esophageal. Esophageal is pertaining to the esophagus. Vascular, pertaining to a vessel, a blood vessel. Or airy, axillary, pertaining to the armpit or the axilla. Like chronic, pertaining to time, something that is chronic, goes on over time. Like cardiac, pertaining to the heart. We did it! We made it to the end of our word endings or suffixes. We looked at some different suffixes. We talked about categories of suffixes, diagnostic suffixes, procedure suffixes, and adjective suffixes. Hope you learned some new medical terms today, got a little better idea of how these suffix word parts complete words, and learned a little something fun. Thanks for tuning in. If you want to learn more about combining forms, some medical term basics, prefixes, check out some of my other videos. Thanks for stopping by.